everyone. Thank you for joining us this Thursday morning. My name's Laura Katawaki, and I'm the president of the CAG Student Connection. And so I just wanted to take the time to provide you with a little bit of information about the Student Connection. So the Student Connection is the student arm of CIHR, and we're a national network for students and recent graduates who are interested in aging issues. And anyone who's a member of CIHR and also happens to be a student or a recent graduate is a member of the Student Connection. Our Student Connection is organized by student members who are elected, and we just recently had an election for the president role. So next week we're going to have a new president who will take over my role, Ariane Massey. Now the activities that the Student Connection are responsible for include representing the interests and concerns of students, optimizing benefits for students, and facilitating participation in CIHR. And normally during the conference, we would be offering a lot of activities for students, but unfortunately, of course, we can't do that. So we've had to move online, but we are very lucky today that CIHR, who normally do a breakfast session for us during the conference, have very kindly agreed to continue to do an online session for the students to tell them about their different programs and scholarships and research and other things that will be of interest to you. So we're really excited that we're still able to do a little bit of our regular conference stuff today. And if we can go to the next slide. So if you're interested in finding out more about the Student Connection, you can visit our website, which is here on the slide. And then I also just do want to mention some events that are happening during the eCAG2020 this week. So obviously there's this CIHR event that you're attending right now. We do have our AGM, which is going to be directly after this session. And there's a Zoom link on the slide, and I'll put it in the chat box afterwards in case any of you want to attend. It will be an opportunity to learn more about the Student Connection. It's not going to be a very long meeting, so maybe like 15 or 20 minutes. And it'll be a chance to meet the executives and ask any questions that you might have. So you're welcome to join us for that. And then I also just do want to highlight that CIHR is having their AGM and their keynote on Friday, October the 23rd. And so the AGM is at 12 p.m. EST. And the keynote is at 1 p.m. EST, so I'd encourage you to attend those events as well. And so without further ado then, I'm going to get on to our main event and invite our speaker for today. And our speaker is Dr. Jane Ryland, and she's the Scientific Director of the CIHR Institute of Aging. And she's also Distinguished University Professor at the University of Western Ontario and scientist in the Molecular Medicine Research Laboratories at Robarts Research Institute. She is a cellular and molecular neurobiologist, studying the consequences of age-related changes in the brain and neurodegenerative diseases. And she's recognized internationally for her contributions to the studies of neurobiology and also Alzheimer's disease. So she has a lot of content that she'll be covering today, and if you're interested in learning more about her, you can find her bio on the CIHR website. And so now I'll turn the presentation over to Jane.
Thanks very much, Laura, and thanks, Anthony. I'm just going to put my slides up here. So I'll just be a second while I get that done. There we go. Oops, I just need to put this onto, there we go. I'm hoping everybody can now see my slides and hear me. So as Laura mentioned, I'm Jane Ryland. I'm the Scientific Director of the CIHR Institute of Aging. And I'm really pleased to be able to meet with you today to talk about some of the work that we do at the CIHR Institute of Aging, the programs that we have, and some of the activities that you as trainees can be involved in. But then also to talk about the training programs and support systems that CIHR have and some of the modules that you can take advantage of to be able to guide your training. So let's get started. The talk that I'm going to give will probably be about 35 minutes in duration. And then there's an opportunity to follow up with any questions afterwards. And so as Anthony and Laura mentioned, then you can put your questions into the chat, and then we will have time for that and discussion. And certainly we're always available for you to reach out to us if you have other questions after the presentation. So let's get started. We know that the population demographic, aging demographics in Canada is changing dramatically, actually, and it continues to change. So for example, if we go back to about 1850, about half of the population was under the age of 14 then. It's hard to believe. I mean, it's quite surprising, actually. And only about 3% of individuals were age 65 or older. That has changed, and around the year 2011, the numbers of individuals in those categories was approximately equal, and now it's actually reverted, so that there are more individuals age 65 and older than there are under the age of 14. And so when we look at the next slide, we see that in about a year ago, there were about 6.5 million people age 65 and older. And half of those individuals are made up of the so-called baby boomers. The baby boomers are such an interesting group of individuals because it's a large group of the population. They're a relatively healthy and vibrant group of individuals with aspirations for a very long life. And so this is going to have a big impact on our population as we go forward. Another measure that we're very interested in are the number of centenarians. So those people that are 100 years of age and older. And about a year ago, there were about 11,000 individuals age 100 and older. And this next slide shows how that's going to change over the coming years. So for example, if we look at where we're at now, around 2020, there's about 11,000, as I mentioned. And if we go out about 40 years, we can see that that goes up about 7-fold. The other interesting point that you see from this particular graph is that by far, the number of the individuals over age 100 are women. Women tend to live much longer, and that certainly is borne out by the data that's in this slide, showing that the vast majority of people over age 100 are women. So that needs to be considered when we think about special needs of some populations and how men versus women respond to certain health challenges, respond to drugs, for example, and make sure that there's an inclusion of both women and men in all sorts of trials to do with healthcare and disease. So another really interesting point that when we start looking at population demographics around the world now, not just in Canada, when we look around the world, one of the interesting measures that's being tracked, particularly by the World Health Organization, is what's called super-aged countries. So there's a couple of different definitions for super-aged countries. So you can use either the population age 60 and older or 65 and older. So if it's 60 and older, it's 30% of the population. Canada would become a super-aged country by 2035. If it's age 65 and older with 21% of the population in that group, then in fact, by 2025, Canada becomes a super-aged country. So if we look at these maps, in 2015, just 5 years ago, Japan was the only super-aged country on Earth. Now, if we look forward only 20 years to 2030, or 15 years, I should say, from now to 2035, now there are dozens of countries that are super-aged. Certainly Canada is in that, and a number of European and some Asian countries as well, reaching that super-aged population. So this really implies a big change in the population demographics around the world and speaks to issues that need to be considered for the aging population. I'm going to come to some of those points in just a moment. So if we look at aging and we look at impact of disease, so this graph has all of these wavy lines, and what it shows is that the number of disorders or medical conditions that individuals may have at certain ages. And so certainly as we go from the lighter color to the dark color, we see that individuals with a greater number of medical conditions or disorders are in the higher age group than the lower age group. And so if we look, for example, people around the age of 65, for example, and use the measure of 3 conditions, so that could include diabetes, it could include high blood pressure, it can include arthritis, it could include cognitive disorders like dementia, for example. The average is that by age 65, about 1/3 of people have 3 or more medical conditions. If you now move ahead and look at individuals over the age of 85 or over the age of 80, now 2/3 of individuals have 3 or more medical conditions. So this then speaks to the needs of individuals as they age within our population, and certainly what we need to consider when we're thinking about our aging population. One topic that is receiving a lot of attention at the moment is reduction of risk and prevention of disease. And so this particular slide speaks specifically to dementia. And so looking at what are the risk factors for dementia and how can one reduce the risk or indeed prevent the onset of dementia. And so this slide shows a wonderful paper that was published just this year in 2020 about dementia prevention and intervention and care. And I would really recommend that you go to the Lancet commissions and look at this because it deals with dementia, but it also deals with a lot of other health challenges and risk factors for individuals as they age. And so when you get the handout of these slides, you'll have the reference here that you can go to. But basically what it's saying is that there are a number of risk factors that exist in early life, in midlife, or even in later life that can have interventions. And so interventions could in fact reduce the risk for development of certain disease conditions, in this case dementia, and reduce the prevalence of these diseases going forward. So this is an area that certainly we're very interested in. I'm interested in terms of my own research, and this is the area that I work in. And I think this is something that we need to really think about as we move forward to ensure that we can reduce risk of most disease conditions or medical conditions, and including dementia. My slides are not advancing at the moment. Oh, there we go. And just the last slide that relates to this is to bring to your attention the World Health Organization Decade of Healthy Aging. So they're embarking by 2021 on what they're terming the Decade of Healthy Aging. They found and identified 10 priority areas that need attention, and those are listed on this slide. I don't have time to go through all of these points, but the topic of risk reduction and prevention certainly figures very prominently here. And again, this is another topic that I would encourage you to go to. Go to the WHO website. They have a wonderful document that you can download to look at these 10 priorities. And these are important across all subdisciplines to do with aging. Everyone will find something there in terms of the research that they do and their interests. So let's turn now to CIHR. So I want to talk a little bit about the CIHR Institute of Aging, the programs that we're involved in, and then I will come to the training programs that CIHR offer across all of CIHR. And then the final slides, there's probably about 15, my last 15 slides, each one deals specifically with a given program, and I won't be able to go through those in the time frame that I've got available with you here today, but you'll have those and you can go to those. So we'll cover off the more overarching points. So CIHR, Canadian Institutes of Health Research, is Canada's federal funding agency for health research. It's part of the health portfolio, and I'm going to show you that in just a moment. And we support the Minister of Health in maintaining and improving the health of Canadians. And obviously this is done through research. Oops, sorry. CIHR's mission is to create new scientific knowledge, and that's what you're doing through your research. And this enables translation into improved health, more effective health services and products, and strengthening Canada's healthcare system. So I mentioned a moment ago that CIHR is within the portfolio of the Minister of Health. So we report through to the Minister of Health. And we work very closely with other agencies and divisions within the Ministry of Health. So with Health Canada, the Public Health Agency of Canada, and the Canadian Foundation for Healthcare Improvement. And we also work very closely with other tri-council agencies, some of which you will be familiar with. So NSERC and SHIRC, also NRC and the CFI organization as well. So we work across and partner and collaborate with all of these agencies in our activities and our programs. So CIHR is made up of 13 virtual institutes, and you can see the names of these in the color wheel on the right-hand side of this slide. This is a unique model actually for funding agencies for health research. The CIHR institutes share the responsibility for fulfilling the mandate of CIHR, with each having their own specific mandate to work with them. Each institute supports a broad spectrum of research in its topic mandate areas, sets priorities for health research agenda, and works in consultation and partnership with stakeholders. And this reflects the emerging needs of health needs for Canadians. The model enables optimal use of existing knowledge, so translation of knowledge, for example, mobilization and implementation of knowledge to fill research gaps, to address emerging health needs, to minimize duplication, and certainly to build capacity. And part of what we're talking about here is capacity building of trainees today. So each of the institutes gets a budget that we work with to be able to promote our priority initiatives. And I'm going to talk about some of those initiatives in just a moment. So the mission and the mandate for the CIHR Institute of Aging obviously is to support research, and this research then promotes healthy aging and addresses the causes, the prevention, screening, diagnosis, treatment, support systems, and palliation for the complex health needs of older individuals. And I mentioned WHO a moment ago and their decade of healthy aging. So we work in concert with the ideas and the programs put forward by the WHO in relation to healthy aging, and many of our programs and our initiatives would be within the same context associated with healthy aging, but also meeting the challenges of the aging population. So we currently are working on a 2-year strategic plan, which runs out until next year. And there are 2 main pillars in this strategic plan. So the first is the health and wellness over the trajectory of aging, so that the healthy aging aspect, but then also the second pillar addresses those health challenges, those medical challenges, for example, that may that may exist for older populations. Within that, we have a number of cross-cutting strategic directions, and that is to be able to always look at our programs with a lens of an Indigenous perspective, capacity and training, which is what we're talking about today. And then we also take an active convener and catalyst and leadership role in relation to research and aging, both at the national and the international level. We have a large number of programs, and those are shown in these various colors, some within the healthy aging pillar and some within the health challenges pillar, some that are cross-cutting, and then many that are within the cross-cutting strategic directions as well. I'm not going to talk about all of these today because we certainly don't have time, but if you go to our website, you'll be able to see a lot of information about all of these, and certainly we're always available to answer any questions that you might have. So let's move forward then and look at some of the the programs that are here. As I mentioned, I'm just going to address a few of these. And the ones that I'm going to talk about, I think are ones that probably relate to many of the types of research that, that you will be carrying out within your training programs. And we've tried to select them that way. So the first that I'll mention is the CIHR Dementia Research Strategy. And you're going to see a number of slides that look similar to this at the beginning of each of the programs that I'm going to talk about. And what the slide does is list the various institutes within CIHR that we collaborate with. And you'll recall that I said that there are 13 institutes, and we are very active in partnership with other institutes that fit the scope of the program for individual initiatives. So you can see the ones that we partner with here in terms of dementia research. So the dementia research strategy is a collaborative effort, and the goal obviously is to advance research and innovation around dementia, Alzheimer's disease, but other forms of dementia as well. There's both a national and an international component associated with this. So on the national level, this is to support excellence on research in dementia in Canada. But then also at the international level, we participate in and collaborate with and provide leadership in various international initiatives to do with dementia research. The collaboration is clearly a key to success within the dementia research strategy. So you can see on the right-hand side of this slide, the logos of a large number of organizations. These are both funding agencies as well as nonprofits, as well as other companies, in fact, pharmaceutical companies, for example, that we work with to bring forward the dementia research strategy. So as I mentioned, we collaborate with other CIHR institutes, we collaborate with partners nationally and internationally, and we're always looking for new partners and welcome new partners to join with us in this initiative to help increase the funding envelope that we can bring to this work, whether it's for grant funding for the research or whether it's for trainees. So I mentioned the various programs. So the national and the international component. I'm just going to go ever so briefly through the two parts of the national component, the CCNA, and indeed some of you may in fact be working in laboratories where your supervisor is a CCNA, Canadian Consortium on Neurodegeneration and Aging investigator. You may indeed have funding from the CCNA to carry out your work. I will mention also briefly the new directions in dementia research. What I won't mention here are the international components because of the limitations of time, but we have 3 active partnerships ongoing at the moment where we fund investigators to partner and collaborate with international scientists. And also I mentioned our convener, catalyst, and leadership role. And of course, in context with today, our capacity building role and training programs. So let's look now at the national component. So we'll look at CCNA first. CCNA is now in phase 2 of its funding. It started in 2014 and was created then. And it now has just been refunded up until 2024, another 5 years. You can see the amount of funding that was put forward by CIHR and its partners for these 2 phases of research. And it's important to note that there are 3 phases, or 3 themes, at least I should say, within this research strategy. So prevention, treatment, and management of neurodegenerative diseases of aging, all to do with dementia, Alzheimer's disease being an important one. And the goal here obviously is to improve the quality of life of Canadians living with these disorders, and also to improve the life of their care partners. And you can see in this infographic on the right-hand side, the 3 different themes. There's 19 teams amongst that. And importantly, there's over 300 researchers across the country that are engaged in this, and a large number of trainees associated with these researchers and clinicians carrying out work. There are cross-cutting platforms and themes that then support that research as well. So you can look at those when you get the slide deck, and also go to the CCNA website to learn more as well. So just a couple of words about CCNA phase 2 activities. They've just finished phase 1 and submitted their report on the first year of phase 2. And so this infographic shows by numbers what's involved, the number of publications and presentations, the number of people and trainees involved. They report that 167 trainees were involved at this point in time. And indeed, as I mentioned, some of you may be in the audience. CCNA is really a value added aspect of dementia research in Canada. It brings forward infrastructure that's needed by many investigators. It provides synergy and team building, and offers a lot of opportunity for cross-team collaborations. Networking for early career investigators and trainees is extremely important. At the annual conference every year, trainees present their research. We have poster competitions. And a lot of opportunity to be able to interact with researchers from across the country. And I just mentioned the annual Science and Partners Day, and there's also outreach opportunities. And for any trainees that are interested in outreach opportunities, that can always exist as well. So let's move on just momentarily to the new directions in dementia research. There's 4 areas that have been promoted and funded over the years. The Posselins Chair in Women's Brain Health and Aging is currently active. Dr. Gillian Einstein from University of Toronto holds that chair at the moment, and she has trainees working with her. And that's basically to look at cognitive aging and disorders, but putting a sex and gender lens on that as well. There was a big data component that is wrapping up shortly to generate and optimize and look at sharing and connecting data both at the national and international levels. And 2 other really critical parts: social inclusion of individuals with dementia and caregivers. Certainly stigma and ageism is a critical part of what is happening with aging and dementia, and reducing stigma is critical. So these studies looked at interventions and programs to reduce that. And then also from looking from the Indigenous perspective, we supported and funded grants in the area of dementia care research that uses community-based participatory methods, both rural and urban Indigenous populations. And there was also a training component associated with this to build capacity among Indigenous scholars and students. Let's move on now to the Canadian Longitudinal Study on Aging. Indeed, some of you may be actually using CLSA data. And I know last year when we actually met in person for breakfast, I asked that question, and a number of trainees in the audience put their hands up, indicating that they are using CLSA data to be able to carry out their research. And so there's great opportunities within this platform. It's a longitudinal cohort study, over 50,000 individuals in the later years of life, coming in at age 45 up to 85. And in fact, aging through the study of over 20 years to be able to see the impact of all sorts of environmental and lifestyle and medical issues on the aging process. And so we're in what's called follow-up data collection number 2 at the moment. This will end in 2021, and there are still 4 more 3-year follow-up data collection. So that runs out for another 12 years after next year. A lot of questionnaire and as well as in-person clinical and physical testing of these individuals. So an incredible wealth of information available. And this next slide, which I can't go to in detail, shows basically in 3 large buckets the types of information that is gathered on individuals in this cohort study. So both demographic and lifestyle, health issues, and social issues. So if you are interested in asking questions about aging and the impact of any of these types of factors on the aging process, CLSA data is absolutely the place to go. And so this actually is a screen capture from the CLSA website. You can see the website listed here. Data access for grad students and postdoctoral fellows is free. you can apply, and your supervisor can apply to be able to access this data and to be able to then ask just a wealth of questions, any place your imagination can go, to be able to ask questions about aging of Canadians in society. So when you get your slide deck, you'll be able to see how to apply for this if you're interested. Another area quite different is the area of geroscience. We have funded projects to do with linking aging to chronic disease. You can see how this actually could link with the CLSA database, but most of these studies would be actually on the biological side. So trying to link how chronic diseases are driven by aging and what those links are there. So everything from genetic to dietary. We are part of the diabetes mechanisms and translation studies, and so we're part of the funding that is for that, and are quite happy and proud to be able to be part of that important initiative. I'm going to mention healthy cities. This is an area where there are a number of training programs. So of course, chronic diseases and conditions can respond to abnormal environments and in fact be promoted by or exacerbated by abnormal environments. So we have a large program at CIHR around healthy cities, age-friendly cities. You can put in a lot of age-friendly communities, you can put in a lot of contexts. Obviously, we're interested in the impact of life, the lifestyle and the environment for aging adults, aging individuals. And so a whole wealth of questions are asked within this area. A lot of this is around implementation science. And so some of you may in fact be involved in this, or your supervisors may be part of these programs. And there are training opportunities within these programs. So I would encourage you to go to the CIHR website and look at those. I'm going to spend a moment just talking about COVID and COVID related activities that we've carried out at the Institute of Aging. Obviously, we've all experienced a lot of challenges over the last number of months, not the least of which are older adults. And we all know from what we see in the media, and there's a bunch of headlines from the media here, basically reporting the disastrous consequences of COVID within our long-term care and retirement homes. And so about 80% of the people that died of COVID in Canada up until now have been residents of long-term care and retirement homes. This is absolutely the worst in the world. And so a lot of introspection is being carried out right now to understand why this has happened and what we can do about it, particularly as we move forward to the next wave. So here's just a few facts. So COVID stats, people age 60 and older make up 24% of the Canadian population, but 36% of COVID cases. If we look at other age groups, we find that if we look at 80 years and older, they're only 18% of all of the cases, but 82% of the deaths. But we look at the number of cases per 1,000 population, and it's 3 times greater than individuals age 40 to 49. And when we look at where older adults live, those age 65 and older, only 1 in 10 lives within nursing homes. So obviously, when we see the number of deaths in nursing homes, then we can see that there's really something very, very wrong with the situation. And those over age 85, there's 3 in 10. So we actually set about to try to, as the Institute of Aging, to try to understand how best to approach the research needs and priorities. And so we did surveys, we did interviews, and met with a number of groups to understand what the priorities were. And we identified 3 priority areas, key areas: the response of older adults to disease, vaccination, and therapeutics. Another area was mental health and isolation, which is a huge topic, particularly for those in long-term care, and then supportive care needs. We also identified 4 cross-cutting themes: equity, diversity, inclusion, ethical and moral considerations around late life, evidence-informed practices for older adults, and then the integration of digital health technologies and how this could be used to help everyone, but in particular older adults during the pandemic. We've published this as a manuscript in the Canadian Journal on Aging, and you're welcome to go there to see this information. And so you'll be able to find this from the slides when you get them. I'm going to turn to the top need that we found through this survey, and that was long-term care. So I'm going to talk just momentarily about an initiative that we started around long-term care called Long-Term Care Plus, acting on pandemic learning. So we along with the Institute of Health Services and Policy Research, have partnered with the Canadian Patient Safety Institute and the Canadian Foundation for Healthcare Improvement. And they had started what they call 6 promising practices to try to mitigate against infections and the problems that we had in April and May when the second wave of the pandemic comes along. So now essentially, and you can see those in the blue box. They're all very practical types of interventions. And what we wanted to overlay on that was a research component. So we devised a funding opportunity where we could have implementation science teams come in and work with long-term care and retirement homes and be able to actually analyze and get evidence on the implementation of these 6 promising practices to see what works in what context, and then to be able to use that information to scale up and spread to other nursing homes and long-term care homes. And so I won't go into that in any more detail at this point, but you can certainly find more information at the website that's shown here. And then I'm going to come to capacity building. So capacity building is something that the CIHR Institute of Aging is always very keen to be actively engaged in. And part of this is through providing training opportunities with the various initiatives that I've just spoken about, or being able to add funding to various initiatives so that trainees can be recruited to those initiatives. One of the other things that we are very proud of and really love being able to engage in is our summer program in aging. So the summer program in aging, or SPA, has been in existence since 2006. And this is used to focus on specific topics each year, and I'll come to that in the next slide. And allows for capacity building within those areas, and in particular with research and aging, and to align then with the Institute of Aging strategic priorities. We use this as a training platform for CIHR best practices such as grant writing, peer review, equity, diversity and inclusion, and SGBA, sex and gender-based analysis. SPA is certainly become increasingly known across Canada, and we always have many more applicants each year than we're able to bring to our program. And indeed now, because it's been running for so long, alumni from the program are now independent investigators, and they now are being able to send their own trainees to the SPA, and in fact they act as mentors at the SPA. So you can see on this slide the types of topic areas that we have had over the last few years and for the next coming couple of years. So physical activity and aging, technology and innovation supporting health of older adults, geroscience. And then this coming year, longitudinal studies in aging. So the Canadian Longitudinal Study on Aging, CLSA, will be a host. And then in 2022, dementia is the topic, and the CCNA will serve as host. So I would encourage you, if you're interested in this, to look for our upcoming announcement. Should be coming out within the coming weeks, to be able to apply for to 2021, to be able to attend the longitudinal studies in aging aspect. And of course, that it's not just focused on that topic. We have much more broad cross-cutting professionalism and research topics that we cover. We have about 40 trainees from Canada each year, and we like to bring in international trainees as well, and normally there's about 10. So we've had over 500 trainee participants since the inception of this program. Certainly, if you're interested in this, reach out to us, and we'll be able to provide you with information. A couple of other topics: health system impact fellowships. We sponsor this. We sponsor yearly fellows each year, both at the doctoral and postdoctoral level. And this is for experiential learning opportunities within the health system. So if you're interested in that, reach out to us. So in 2020, we are supporting 2 doctoral awards and 2 postdoctoral fellowships. And then also health research training platform pilots. So this is to train the next generation of health researchers and highly qualified personnel. And there are 3 areas that we work in: vascular cognitive impairment, stigma associated with LGBTQ and life course mental health wellness, and then also digital health and aging. So some extra opportunities there that you might want to consider. Lots of information on the CIHR website, but also reach out to us. Okay, so now I want to turn to the more general aspect from CIHR, supporting the next generation of researchers. I'm going to talk about the CIHR training strategy for the next few minutes, and then the slides that follow that you will be able to access in the handout basically list all of the opportunities, the key training resources and tools, and all those opportunities. So let's look at the training strategy for CIHR. So they have tried to link training challenges with future needs of trainees. And so as you go through the training elements on the CIHR website, you'll see the links between these. So health research evolving, trying to couple that with research leadership for tomorrow. Career paths changing, trying to look at what leaders need across various sectors. And then expertise and critical areas, then what are those critical priority areas? So, the CIHR is working very hard right now to try to anticipate what the needs are for trainees as you enter into a wide range of different career possibilities, not just necessarily as a researcher and certainly not just as an academic, but the whole range of different professional opportunities that may lay out there for you. So, so lots of information on that and career paths as well. And so breaking that down even a little bit further, so the leadership across in research or across sectors, or the critical areas that experts are needed. You can see some of the topics that are listed here. And then when you go to the website, you can drill down to these various possibilities. So that could be a research leader within academia or within government or within other institutions. Or it could be moving out into the private sector, or even changing direction entirely and getting new education to meet the expertise that's needed in other critical areas, whether that's business or law or teaching, any other sorts of areas. So you'll see that there are a lot of examples there. And then some of the things that you need to consider as you start progressing through your own training. So this is just a screen capture from the training web pages. And so you'll see that there are a lot of opportunities there, all the way from awards programs and training initiatives through basically a career hub, strategies and policies, and then basically how to reach out to stakeholders and collaborators as well. So there are a number of modules, and I'm going to put them up here. So these modules are available for researchers, for trainees, for everyone to be able to go, to be able to read the critical information relative to the topic, and then to actually do some kind of a questionnaire that helps you understand how much information you've integrated, and areas where you may in fact be missing information, and then can move forward to get more information. So for example, the sex and gender training modules, there are 3 there. I've done them. They're absolutely outstanding. And they're challenging, and they challenge you on what you need to know. On conscious bias, I would recommend that everybody gets this. I know a lot of graduate training programs now include modules on conscious bias. If yours doesn't, this is a great opportunity. And then even down to the College of Reviewers, where you can learn and become a participant in how to review research properly and be mentored on how to review research. And this actually helps you when you put together fellowship applications or other studentship applications, or indeed research grants. This basically speaks to a module that they also have to help you develop your individual plan. And this, it says empowering trainees, and I can't speak to this enough. It helps you develop where you are in your training, what goals you have, and actually work towards goal setting. You should do this in consultation with your research supervisor and your advisors, and to be able to do it as a stretch exercise to see where you need to go, where you're at now, where you need to go to. And so there's a lot of great advice, as well as tools to be able to do this if you go to this web link. I mentioned the College of Reviewers. Being able to look at other people's proposals and review those helps you understand what's successful in grant writing, fellowship writing, studentship writing. And so I would recommend that you go to look at that. And you can actually become a participant and be mentored in this as well. There's a postdoctoral fellowship training program in that as well. And I think I'm coming near the end here. So CIHR has launched a number of new initiatives to do with equity, diversion, and inclusion. And so you can go to the websites and see the latest actions by CIHR in relation to EDI, look at our action plan. This includes other tri-councils. And then also look at the various resources. And if you go back to the tool I mentioned earlier, you can look at what your current knowledge is, you can test your current knowledge, but then also be given insight into where you can move to be able to expand your horizons and understanding in this area. Okay, so that was my last slide. The next about 15 slides actually then move on, and there's a slide for each individual program. I'm not going to work through those because there's a lot of technical information that basically lays out a lot of how to apply and when to apply and all of those sorts of things. But you'll have this in your handout package, and so you'll be able to go to that to be able to look at the technical information. And of course, we're always here to answer any questions that you might have. So I'm going to stop sharing now, and then maybe we can go back to looking at the questions, and we can answer any questions that you might have.
Hi, Jane, it's Pat. So far, we don't have any questions. So just a quick reminder, if you do have a question, please put it in the chat right now. And I also wanted to draw you to 2 things. Susan Rogers, one of our project leads at the Institute of Aging, has put 2 messages in the chat. One is to look for the SPA 2021 training opportunity for longitudinal studies on aging to be on ResearchNet in December 2020. So that's coming up in December, so not too far. And the other point is to sign up. If you haven't already done so, please sign up for the Institute of Aging newsletter, and that link to sign up is in the chat as well. So I'm not seeing any questions right now. Does anybody have any questions or anything else to add?
Well, certainly if you think of any questions, particularly when you get the handout of the slides, or as you go away and reflect on what you've just heard, please don't hesitate to reach out to us, because we're always happy to to be able to answer any questions that you might have or guide you to the right information that you might need.